You're sitting there minding your own business. Maybe you sneeze or blow your nose, and suddenly there's blood. A nosebleed. And if you're like most people, there's this brief moment of panic where you wonder, am I dying? Spoiler alert, you're probably not. But here's the thing, nosebleeds are way more common than you think, and understanding why they happen might just save you from a lot of unnecessary worry. So let's talk about the numbers first. Studies show that up to 60% of people in the United States experience a nosebleed at some point in their lives. That's more than half the population. The medical term for this is epistaxis, and it accounts for about 0.5% of all emergency department visits. Now that might not sound like a lot, but when you consider how many people visit emergency rooms every day, that's actually significant. Here's what's really interesting. Your nose is basically a biological goldmine of blood vessels. The inside of your nose is lined with delicate tissue called mucosa, and it's packed with tiny blood vessels that sit incredibly close to the surface. We're talking about an area called Kieselbach's plexus, or Little's area, and this is where 90% of nosebleeds start. It's right at the front of your nasal septum, that wall separating your two nostrils. These blood vessels are so fragile and so exposed that they can break from the slightest thing. And that's the key word, exposed. Your nose is constantly dealing with extremes. Hot air, cold air, high humidity, low humidity. Studies found that nosebleed rates peak in February, March, and April, particularly in colder climates. One German study, tracking over 114 medical practices, reported the lowest rate of nosebleeds in August, at about 7 patients per practice. But by February, that number more than doubled to nearly 15 patients per practice. But dry air is just the beginning. Research has identified a whole range of risk factors that make nosebleeds more likely. If you have allergic rhinitis, chronic sinusitis, or hypertension, your chances increase significantly. One major study analyzing 2,405 patients with epistaxis found that these conditions, along with blood clotting disorders, all elevated the risk. Age matters too. The study found 2 peak periods for nosebleeds: children under 10 years old and adults over 50. Why kids? Well, kids pick their noses more. Let's just be honest about that. Why older adults? As we age, our nasal mucosa becomes drier and thinner. Blood pressure also tends to be higher, and that makes bleeding harder to control once it starts. Research indicates that patients with higher systolic blood pressure were more likely to need aggressive treatments, like nasal packing or cauterization. Now, before we get into how to fix a nosebleed, let me ask you to hit that like button if you're finding this helpful. It really does help us reach more people with this kind of information. Let's talk about the 2 types of nosebleeds. The first type is an anterior nosebleed. This is the common one that starts in the front of your nose, from those fragile blood vessels. These account for about 90% of all nosebleeds, and honestly, they're not usually serious. The second type is a posterior nosebleed. These start deep in your nose from larger blood vessels. The blood often flows down the back of your throat, and these can involve heavy bleeding. Only about 10% of nosebleeds are posterior, but these require immediate medical attention. So what actually causes your nose to start bleeding? The most common culprit is dry air. When your nasal membranes dry out, they become crusty and cracked. Then anything, a sneeze, blowing your nose, even just rubbing it, can rupture those tiny blood vessels. If you're taking blood thinners like aspirin or warfarin, you're at higher risk because these medications interfere with your blood's ability to clot. Research shows that alcohol also interferes with platelet activity, making blood clots form more slowly. Nasal sprays are another factor. If you frequently use decongestant or antihistamine sprays, they can actually dry out your nasal membranes over time. Upper respiratory infections also make you more prone to nosebleeds because they cause inflammation, and you're constantly blowing your nose. And then there's trauma, nose picking, which is way more common than people admit. Studies have found that structural problems, like a deviated septum, can also increase nosebleed risk because uneven airflow causes certain areas to become extra dry. Now here's the critical part. How do you actually stop a nosebleed properly? The biggest myth is tilting your head back. Don't do that. When you tilt your head back, blood flows down your throat. You can swallow it, which irritates your stomach and makes you vomit. And vomiting can restart the bleeding. Medical guidelines are crystal clear on this. You need to sit upright and lean slightly forward. Here's the technique that actually works. Sit up straight, lean forward slightly, and pinch the soft part of your nose, not the bony bridge, the soft cartilage part just above your nostrils. Use your thumb and forefinger to pinch both sides together firmly. Now here's the part most people get wrong. You need to hold this for at least 10 to 15 minutes without letting go. Studies show that most nosebleeds will stop within 10 to 20 minutes of direct pressure, but you have to resist the urge to peak before time's up. Set a timer, breathe through your mouth, and just wait. You can spray a decongestant like oxymetazoline into the bleeding nostril. Before you start pinching, these vasoconstrictors help shrink blood vessels and slow the bleeding. Some people also put an ice pack on the bridge of their nose, which helps by constricting blood vessels through cold. After the bleeding stops, don't immediately blow your nose or pick at it. You need to give that clot time to stabilize. Don't bend over, don't lift heavy objects, and definitely don't do any strenuous exercise for at least a few hours. The strain can increase your blood pressure and restart the bleeding. For prevention, the science is straightforward. Use a humidifier at night, especially in winter. Apply a thin layer of petroleum jelly inside your nostrils a few times a day to keep the tissue moisturized. If you have allergies, manage them properly. And obviously, stop picking your nose. Here's when you need to worry. If your nosebleed doesn't stop after 20 minutes of proper pinching technique, you need medical attention. If you're taking blood thinners and experience a nosebleed, that won't stop. Get to an emergency room. Medical data shows that about 6% of people who experience nosebleeds will seek medical attention, and about 0.2% will require hospitalization. If blood is flowing heavily from both nostrils, or you're feeling dizzy or having chest pain, those are red flags. When you get to the hospital, doctors have several treatment options. They might pack your nose with special gauze to create pressure at the bleeding site. They could use cauterization, applying a chemical like silver, nitrate, or using heat to seal the blood vessel. In severe cases, they might use embolization, a procedure where they block the blood vessels. Recent research analyzing 41 studies with over 1,600 patients showed that embolization has an immediate success rate of about 91%. The bottom line is this: nosebleeds are incredibly common, usually harmless, and almost always treatable at home with the right technique. But they're also your body's way of telling you something, that the air is too dry, that you need to manage your blood pressure better, or that you need to stop using so much nasal spray. Listen to what your nose is trying to tell you. Take the preventive steps, and most importantly, remember to pinch, not tilt, when that next nosebleed happens. If you found this video valuable and want to learn more about health, topics that actually matter, please subscribe to our channel. We're here to give you evidence-based information that can improve your life. Thanks for watching, and I'll see you in the next one.